The cancer I have chosen to discuss is carcinoid lung cancer. So carcinoid cancer is a type of lung cancer that is produced by carcinoid tumors. So those tumors are made up of neuroendocrine cells. So with neuroendocrine cells, they are found throughout the body, including the lungs. They're similar to some types of endocrine cells, so they do produce hormones or hormone-like substances. They also resemble nerve cells because they can also secrete neuron transmitters. So with the carcinoid lung cancer, it causes these neuroendocrine cells to produce too quickly, so then a tumor forms. While carcinoid lung cancer, is the tumors in the lungs, the carcinoid tumors actually don't usually start in the lungs. They're usually found in the stomach or the small intestine and the colon to begin with. So it's actually not super common for carcinoid tumors to start out in the lungs. With the carcinoid lung tumors, there are two main types. There are typical and atypical. So with typical carcinoid tumors, which is more common of the two types, they grow very slowly and they rarely spread beyond the lungs. So that would be one that is found mainly in the lungs. Atypical carcinoid tumors are more rare, but they do tend to grow more rapidly, and they also will metastasize beyond the lungs. So central carcinoid tumors are found in the walls of the large airways of the lung, and then there are also peripheral, which are found closer to the edges of the lungs, so that'd be along the airways. So it's actually quite rare. It only accounts for about 1 to 2% of all lung cancers, according to the Cleveland Clinic. It's not clear whether it's due to smoking or air pollutants or other chemicals. They do not believe that it is. However, it does put people at more of a risk. It also says that women are more likely than men to have carcinoid lung tumors, and it's also more common in Caucasians than it is in other ethnicities. So some of the symptoms with the carcinoid lung tumors, a lot of them you don't see symptoms. They are asymptomatic. So you may have like a chest cold or something else going on where you would get an x-ray and then they would find those tumors. But if they do have symptoms, some of the things that you can see, you could see some facial flushing, you'll have wheezing or asthma-like symptoms, so there'll be trouble with breathing, shortness of breath, you can have hypertension or high blood pressure, you could see some weight gain, and then you also could see an increased amount of both body hair and facial hair. So those are some of the symptoms that you can see. With diagnosis, like I said, a lot of times diagnosis is by like a chest x-ray. Another thing is you could do a CT if that would be if chest x-ray is not clear. Some blood and urine tests can detect abnormal levels of hormones, and that would show that there is a tumor. A biopsy would be completed. That would be when a small sample of that tumor growth is obtained and then tested. So with treatment of lung carcinoid tumors, most carcinoid tumors are treated with surgery. So you could have a sleeve resection. This is an operation where it removes sections of the airway above and below the tumor along with the tumor. And then that section of the airway is reconnected. Another is a wedge resection. That is when a tumor is very small. They'll perform it just to remove a small wedge portion of the lung. a lobectomy. That's a surgical procedure that they will do to remove a portion of the lung. So a lot of times this is performed with peripheral carcinoid tumors, so when it's located at the edge of the lung. Another one would be a pneumoectomy. This is when you would remove an entire lung, so the affected lung would be completely removed. Another would be lymph node dissection. Often the lymph nodes near the lungs are removed to determine if the tumor has spread, so they'll check that lymph node to make sure. Another treatment is radiation therapy. Usually that would be if the carcinoid tumor has spread. They would do radiation therapy or chemotherapy to remove or to get rid of that tumor. So prognosis for people with lung carcinoid tumors really is pretty well. For typical carcinoid tumors, the prognosis is about 85 to 95% with people who have been treated. So that's a 5-year survival rate. People who have been treated for the atypical lung carcinoid cancers have a 5-year survival rate of approximately 50 to 60%. So that's in the lung carcinoids that have not spread to other portions. So that would be the 5-year survival rate.